Today, we are at the 9th Annual Lions Diabetes Symposium, where the theme this year is the power of connection, people, practice, and progress in diabetes care. We have a great program lined up for you, where we will be having case discussions, practical workshops around insulin, liver health, cardio-renal metabolic health, all for the better outcome for our patients. Join us.
I would like to extend a warm welcome to you all for the 9th Annual Lions Diabetes Symposium. Progress in healthcare is not achieved in isolation, but through the synergy of minds, and there are great minds gathered here today with us.
It is a true pleasure and privilege to welcome you to the 9th Annual Diabetes Symposium. 9 years ago, we began a remarkable journey under the Lions umbrella to establish our multidisciplinary diabetes care centers. But what we began to see was much more than eyes. We were seeing diabetes, its silent reach, its complications, and its impact on lives. From screening to prevention, from awareness to advanced care, we have built bridges that heal and which brings us all together here.
Coming together is a beginning, keeping together is a progress, and working together is a success.
Managing a diabetes patient requires coordination by all the teams, because this is one person. You know, when they come for education, you think, oh, they just need education. But they need also to talk to their physician or their health provider about the insulin that they're using, about their tools. They need to talk about their emotional status. So what we are talking about here is that when people connect, you deliver better health care. If you don't look into the social determinants of health to be able to talk about health equity, you do not go anywhere in delivering care.
We need to educate our patients about what is true, what is not, what must they look into, what must they be careful about. And as societies, I guess, is thinking about how do we send out messages that are helpful for our communities and counter messages that are not true for our patients. One, we must have a plan for continuing care. Whenever you're seeing people, you must have a plan for continuing care. So don't just see a patient once, tell them to come back in 3 months. You need to see this person in totality and think about, are they better off being taken care of at another facility? You can refer them, step them down to a cheaper facility if they can't afford. And for those who can afford, you can step up also.
We should enhance the awareness for female sexual dysfunction. After all, we found that it had a very high prevalence. And then implement regular screening with a validated tool. Then use integrated management strategies in diabetes treatment to improve the overall quality and life of our patients. Things we need to know that yes, you have to optimize insulin care. There's an issue with diet. I'm not a dietitian, and that's why we have a dietitian here. The issues to do with diabetes education. I can see some gaps there that need to be addressed, but do I have the time? And even with those gaps, it's not about do this, do that. It's about working with her to be able to, remember we are gardeners here, so that we make sure she actually gets better control.
Every particular nutrient that God provided has got a function in the body of a human being, whether it is macronutrients or micronutrients.
So we need to see how our patients here locally are responding to certain groups of medications, and glycemic response to metformin has also been reported to differ by ethnic group.
Study population quite important. Our type 1 patients or our type 2 patients who are insulin dependent have to be in these studies. The variability of the sugar is not a factor in it, it's not quite effective. You need to look at the site of the sensor wear. How long has the sensor been worn? You need to look at the meal and the insulin challenges, and that's what we talk about. Our type 1 patients who have the insulin injections multiple times a day.
So type 2 diabetes remission is achievable so long as if the program is structured. Dietary rotation is effective, combining low carbohydrate diet, low ketogenic diet, brings that anticipation of having a new challenge and a new experience.
What are the factors which are associated with erectile dysfunction in this study population? The main one we had increased physical activity was seen to be protective. Surprisingly, age was not quite significant as adjusting for the odds. You can see the adjusted odds ratio. That the older you expected, the older you are, the higher risk. But in this case, when you did the adjusted ratio, it was not significant. Being overweight had initially there was some protection, but after adjusted, we find that there's a loss of that p-value. Duration of diabetes again was significant as a risk factor for erectile dysfunction.
So we have issues maybe with challenges with affordability, where we say we can't afford CGMs. So how can we make it happen when we are sure that this CGM is accurate? It's probably not affordable. So what can we do? So maybe we need to think through and say, should we use CGMs intermittently for certain patients? We need to expand the industry so that more people come in with their CGMs.
When kidneys start misbehaving, everyone gets a little more alarms. But this alarm should start much earlier, before the kidney even starts getting affected. And why do we have this, diabetes, CKD, heart failure, high blood pressure? It's all because they have the same risk factors, right? So we need to prevent those risk factors so that we don't reach at this stage where now we're starting to manage the kidney, the heart. So prevention, number one.
Let this 9th year not only mark our growth, but reaffirm our purpose that through collaboration and compassion, we can outspace diabetes one time at a time.
I'm really happy because such forums bring together all different cadres of people looking after diabetes, nutritionists, diabetes educators, students, doctors, specialists, everybody, partners, strategic partners who help us and support us, the farmers, everybody and anybody who has any interest in looking after the welfare of people living with type 2 diabetes.
Let's share freely, question deeply, and laugh a little too, because innovation happens best when the mind is curious and the heart is light. Let's celebrate 9 years of progress and look forward to many more years of partnership, purpose, and possibility. Together, we are not just managing diabetes, we are reimagining care.
Wow, what an exciting day from the plenary sessions, the panel discussions, the workshops. It has been a fruitful and an impactful day. Thank you so much to our great speakers, our panelists, our participants, our sponsors, and our management for making this day a success. Let's do this again in 2026.